Good afternoon, everybody. I begin this briefing with the most sombre of all messages, sombre of all news. Very sadly, yesterday somebody died, a gentleman in his 60s from a COVID-related illness, and he died in the hospital. Our sympathies go out to him and his family and his friends, and this must be a particularly difficult time for them. I hoped I'd never have to say that during the course of my tenure as chair of the Civil Contingency Authority, and I hope I never have to say it again. I can't guarantee that, but as I say, our sympathies are very, very much with that gentleman's family, and I'm very sorry that they've suffered this terrible loss. This just shows how pernicious and horrible this virus is, and that's why we have got to maintain ever vigilance. We've got to maintain all the requirements and all the stresses and controls to make sure that we're out of this situation as soon as we can, but as safely as we can. Today's briefing will be relatively short, and the panel today comprises myself, Dr. Brink, and the Chief Executive, Paul Whitfield. And the reason for that is that we have a Civil Contingencies Authority meeting tomorrow, and we'll be making decisions. And those decisions will relate to whether or not we can decide whether Thursday, Friday, or whenever we can proceed to phase one of the recovery strategy. Now, Alderney already has asked us to consider whether they can be advanced, and we'll consider that again tomorrow. And Sark has begun its phase one. It's now this morning. It started with phase one of the lockdown process. Its school is open, so their businesses can do a certain type of business as is permitted in phase one. But I emphasise in relation to that, Guernsey and Alderney's decision will be made tomorrow. The figures are going in the right direction. You'll hear statistics from Dr. Brink in due course. But as I've said many times, and so has she said, it's not just the numbers, it's the type of cases, it's the sources, it's unknown community sources, all kinds of factors militate before we can make a decision. Because what we don't want to do is to come out of lockdown and then have to go in again. Even if we do that, we cannot guarantee that that might not be the case, albeit we very much hope that that will not be the case. So as I say, tomorrow at CCA, we'll be discussing if and when, and it is if and when, there's no certainty yet, we can move out later in the week. But that's a decision we'll make tomorrow, and we'll announce it at this briefing at 1 o'clock on Wednesday. But now over to Dr. Brink.
Thank you very much, Deputy Fairbrush. So I'll start off with slide one entitled COVID-19 Case Summary. And I would like to start off too by offering my sincere condolences to the family of the person that died over the weekend. We are thinking of you, and we are so sorry for your loss. If we then look at our overall figures, so our overall figures are going in the right direction. So if we look at the active cases, we now have just over a third of our cases that are still active. So that is encouraging, and it is moving in the right direction. And I think that's of importance as we move forward. But again, we all think about the family who's lost a loved one over this weekend. So if I can have the next slide, please. This is entitled Slide 2, which is second wave COVID summary over time. So this is a slide that I used quite a lot in the first wave, once we progressed for a couple of weeks, to show everyone where we are with our current wave. And if you look at this slide, the top line is a maroon, and that shows us the total number of cases. So you can see those total number of cases now plateauing off. So that's an encouraging trend. But more encouraging is you see the number of active cases declining. Those are indicated by the green line. And of course, the number of recovered cases indicated by the grey line going up. So what we can see by plotting the progress during this wave is that we've got an increasing number of recovered people and a decreasing number of active cases. Now, this is exactly what we want to see as we progress forward. So that is an encouraging picture which we're looking at. So if we go to the next slide, which is entitled COVID Case Breakdown, and I think I've been through the historical ones over the last 2 weeks quite a few times, so I'm just going to focus on our most recent cases. And looking at the weekends, so Friday, Saturday and Sunday, is on Friday we had one unknown community source, and that again was linked to an area of interest for us. On Saturday, we had a total of 8 cases. Case picked up by our border policy, a day one traveller. One was detected through our planned workforce screening. Now, as I think I've discussed with you already, we're going for a very proactive surveillance program. So we're doing a lot of workforce screening, both within health and social care, within other sectors, within education. So we're screening large numbers of individuals through those mechanisms. And one individual was picked up by this planned workforce screening, and there were 6 contacts. And within those 6 contacts, again, there was clustering in households. So there were areas and families that we knew had been infected by COVID-19. So if we look at the situation on Sunday the 14th, there were a total of 4 cases, 3 of which were contacts, again linked to families that we were already aware of. One is an unknown community source, but it was linked through our source tracing. So we've had certain events and areas that we know that there have been COVID activities. So what we've done is some of those people, you might recall, we've put into voluntary self-isolation. And what we're doing now is some testing of those families as we move out of self-isolation, And we detect one such case through that mechanism. Now, this case, in fact, had been self-isolating, had absolutely no contacts. But what is important is there was probably an intrafamilial transmission, and we want to make sure that there is an ongoing transmission out into the community. So this all reflects our proactive case-finding approach that we're adopting now that we're seeing a decrease in the number of cases that are just arising through symptomatic testing in the community. So a very, very encouraging trend. So if we go on to the next slide, which is entitled Slide 4, which is care and residential homes, I won't show this slide again unless we have a change in this sector, but encouragingly, all 3 care homes, we've had 5 cases in care home 1, which was 2 residents and 3 staff members. We've had 2 cases in care home 2, which was 2 staff members, and 1 case in care home 3, which is 1 staff member. We've continued with our active surveillance of both staff and residents of these homes, and we've detected no further cases. So again, a very encouraging profile and something that we're exceptionally pleased about. So if we then move on to the next slide, which is entitled Slide 5, which is age profile of the active cases. Now, I think I've said this before, the reason why I do this graph is it gives us an active assessment of what our current risk is with regard to active cases looking at people's age. And you can see the majority of the cases are occurring in 51 to 60-year-olds. Now, what we have seen with this wave is we have seen the impact of the vaccination program. So we've seen fewer cases and indeed less severe cases in the vaccinated population. So that's promising as we move forward through the various stages of vaccination. I'm going to discuss a little bit about vaccination a bit later. So if we go on to Slide 6, which is entitled Average Number of Contacts per Case Before and After Lockdown was Introduced, what you can see is that as we went into lockdown, you can see that there were over 20 contacts per case, which is not surprising because we had no restrictions at that time. But what you're seeing is a dramatic reduction in the number of contacts per case. This is exactly what we want to see. And if you remember the World Health Organization trio of closed, so closed spaces, close contact and crowds, those are the fundamental principles of an exit from lockdown. And what we're seeing is the efficacy of the lockdown process in limiting those contacts. By limiting contacts, you limit the onward spread of the virus. So of fundamental importance in the lockdown process and monitoring the efficacy of lockdown. So if we go on to Slide 7, which is entitled Symptomatic versus Asymptomatic. So as part of our monitoring process, we look at people that are presenting symptomatic and people that are presenting asymptomatic. And what you see from this graph, if you look on the left, most of it is blue with symptomatic people. So this was at a stage where we knew that we had a exponential increase in cases. We were seeing symptomatic people. So the focus was on testing of symptomatic people, getting them into self-isolation, and then starting to contact trace and work outward from that. If you move to the right-hand side of the graph, what you see is a greater number of patients now being asymptomatic. And this is part of our proactive case-finding approach. So we're actually looking for cases, we're doing source testing, we're doing broader testing of contacts, we're doing workforce surveillance, so we're actually hunting out cases. And this shows the switch over from the reactive, we're dealing with an acute situation, into the proactive, we're trying to find cases. And that'll become increasingly important as we move forward. So if we go to slide 9, and that's entitled vaccine. So what this slide shows is our anticipated time for completion of the first dose of vaccine for individuals. Now this relates to the first dose of vaccine. And what we've tried to do is map out as to when people can expect a cohort to be immunized. So you can see that cohorts 1 and 2, which is and 2A, which is the older as adults, residents and people, staff working in those residential homes, that's complete. Everyone who's asked for a first dose of vaccine has had a first dose of vaccine. Many have also had their second dose. Going on to the over 80s, again, they've had their first dose of vaccine. The health and care workers, it's a very large group of individuals, and that's ongoing, so we're still immunizing that group. Going on to the over 70s, A75s and the over 70, both of those groups are complete, and those, of course, were done at the community vaccination centre, so those groups were first delivered then. The clinically extremely vulnerable group, which are 4A, those are being delivered, 4B, those are being delivered at the moment through primary care. So that's a program that will protect the most vulnerable from a medical point of view. Going down to the over 65s, now we've started booking those, and what we're doing is we're booking in groups of 500, so we just need to manage the expectations, starting at 69 and moving downwards. So what we're asking people is don't all phone us now, because we're working down in blocks of 500 through this group of individuals. We think in that age group, they're going to be about 4,000 people for us to work through. And then we go down from the 18 to 65 into March. Those are the ones at risk, so at a specific risk. 60 years and over into March, and April, 50 and 55 years. So by the end of April, we're hoping to have given everyone who wants their vaccine the first dose of vaccine. After that, we'll look at a population-based immunisation program, and that's yet to be scoped, but that's phase 2 of the immunisation program. But you can see vast majority of the vaccinations are being delivered through a community vaccination centre, but that hopefully gives people a roadmap of when we expect to be where we expect to be in the immunisation program at a specific time date. So if we then go to the next slide, and that's entitled Vaccine Numbers. Now, as of the close of play yesterday, we delivered 16,236 doses of vaccine, which is a phenomenal effort for a very small team of individuals, and I am extremely proud and grateful to them. So of those, 13,146 were first doses of vaccine and 3,090 were second doses of vaccine. So as you can see, the vaccination program is progressing really well, and we just want to keep up that momentum. Now, my final slide, which is entitled Slide 10, is on COVID symptoms. And I wanted to show the slide to remind everyone how important it is to come forward with symptoms, even if they're mild. So things like feeling tiredness of a recent onset, really important. Even if the changes are subtle, come forward and get a test. You will be doing your community a favour. So aches and pains, fever, persistent cough, loss of sense of smell and taste, I think people are well aware of. But the more subtle tiredness, aches and pains, not quite feeling yourself, important that you come forward for a test. Other of the newer symptoms, something that we've been using for some time, are the rashes. There are 2 types of rashes. There's what they call covert toe, which essentially looks like chilblains, but there are all sorts of other rashes as well. There can be vesiculous or blisters. There can be flat rashes. It can even be a lacy type of rash. So lots of different types of rashes. And we do think that you need to get those rashes assessed and speak to your GP about those. Then obviously the more serious signs of COVID, the difficulty, difficult breathing, shortness of breath, if you have chest pain or pressure, those need urgent attention because there could be other things like, for example, a heart problem. So really important that you don't ignore those symptoms. So I think the summary is we're moving in the right direction. We're doing really well. The signs are encouraging, but as ever, we need to be vigilant. We need to be aware of the symptoms, come forward and get tested, because then we can root out all of the case of infection and stop that onward transmission. So that's my update. Thank you, Deputy February.
Thank you very much, Dr. Brinkers. Always very helpful and informative. Now, I normally pass straight over to the next speaker, and that will be our Chief Executive, Paul Whitfield. But I just want to say a few things. Firstly, I want to say that you've heard Dr. Brink say in her outline, and one of the slides she dedicated particularly to it, how the vaccine is going to, how it's rolling out, who it's being rolled out to, and when. Now, we have agreement with the UK about the vaccination process, and we are dependent upon them in relation to how we receive and when we receive our vaccines. So we've got limited scope to move. The parameters within which we move are not non-existent, but they are limited. Now, we receive daily, all of us receive daily, from individuals and groups saying, can you just prioritise me or them or us or whatever? Now, all of those are reasonable. Of course, they're reasonable. People want to make representations, and as they should be, and they are all duly considered. But there is a line, though. We would, if we had the vaccines, we would vaccinate all the teachers tomorrow. If we had the vaccines, we would vaccinate all the police officers tomorrow. We would vaccinate this one and that one tomorrow. We do not have the vaccines available. We are limited by the agreement. But we listen to what people say, and we take that into account. In relation to the way that the vaccines are taking place. What is unacceptable, and it is happening, and it is unacceptable, and it must stop now, is that our very hard-working public health team are being abused, they're being shouted at, they're even being threatened because they are not adhering to what this person or that person thinks should happen in relation to the vaccination programme. Stop it. Do not do that. These are the very people who are trying to keep us all safe and healthy. If you've got a complaint like that, you phone me up, but not anonymously. You phone me up and speak to me, but do so, please, in civil and courteous terms. I understand it's emotive, and as I say, Dr. Brink has said on many occasions, we have the capacity to administer as many vaccines as we can, but we just don't have them. And we're taking advice. She's had to take advice, we've had to take advice, and there are agreements. Now, it's not just the number of people who get infected, and she showed you a slide about which are the groups that have been infected the most with COVID. It's which are going to have the greatest impact upon our health system, who is most at risk. It's undoubtedly the case that in most cases, an 80-year-old who gets COVID will suffer far more seriously than a 35-year-old who gets COVID. That's not an absolute rule, but it's overwhelmingly the general rule. And we have to follow that advice. Science doesn't change, so therefore, please bear with us. Now, moving on, half term was last week, so children are now having the advantage of distance learning, and that's a very good facility, and we commend that to everybody. But I'd just like to say something about the teachers, because the teachers have been not messed around, that's the wrong phrase, but they've had their teaching processes and their lives interrupted greatly by coming in of COVID, going into COVID, being partly in and out. We're very, very grateful to them. They're dedicated people and they're doing a splendid job. So we do appreciate you. We appreciate all the work that you are doing. Do not feel neglected, because you're certainly not. We respect everything you have to say. But now, I think enough from me, and I'll hand over to the Chief Executive.
Thank you, Deputy Furbush. And again, I would like to extend condolences to the family and friends of our lost Islander. Today is the first day back for the more than 7,000 students who attend state schools, and that means a return to distance learning. Half term saw about 260 young people attend education sites, either via invitation or in order to support them, or as the children of essential workers. I'd like to add to Deputy Furbush's comment. I must mention we had some 300 school staff volunteering work during half term to ensure school sites be open for these students, and we want to thank them and head teachers for making this happen. I know how hard you have all worked in recent weeks, along with colleagues, to make this facility stand up. Having worked closely with our senior educationalists who have overseen the development of our distant learning offer, we know it will never be able to fully replace a normal school day, but the focus has very much been on supporting young people and indeed their families during what are very challenging times for us all. The distant learning package allows families to plan the work at a time that suits their needs, as parents juggle work commitments with supporting their children with schooling. I know my colleagues in education believe that flexibility is key for parents and students, and I know the provision and quality of online learning has been welcomed by many, including our teaching union colleagues. I know we've said this before, and I speak as a parent of a school-aged child myself, but it's important that parents and carers cut themselves a little bit of slack, as no one expects you to take on the role of a classroom teacher, especially as so many of you are also working from home. It's difficult. Your child's teacher is on hand to support you and your children, so if you have any questions or concerns or difficulties, please contact your child's teacher, as they will be more than happy to advise and help. As Deputy Ferbrus said, the Civil Contingencies Authority will meet tomorrow and decide whether we move to stage 1 of our exit from lockdown framework on Thursday or maybe Friday. But it's not a given at this stage. If we do, and of course we can't be certain, then there will be a requirement for businesses to notify the state of their intention to operate if they're able to do so within the rules of stage 1. Some of those rules include to operate with a maximum of 10 workers on outside sites and 5 if indoors. All socially distanced, and importantly for stage 1, no customer-facing activity. When notifying us, businesses will have to confirm they understand those guidelines. The web-based notification system would go live the day before we move into stage 1, and will confirm full details at the time of announcing the move, so businesses don't have to do a thing just yet. As we briefly mentioned on Friday, we are conscious that there are people currently within our community who are not ordinarily resident here, but who are in priority groups 1 to 9 for vaccination. We would like to understand how many people are currently in the island who would fall into these priority groups. So if you or someone you know is within one of these priority groups, not normally a resident in the island, but here at the moment and remaining here for the foreseeable future, we would ask them to visit gov.gg/COVID-19 vaccination form to complete an online form that will let us know your personal circumstances. Wherever possible, please do use the online form to help us capture the relevant information. But if this is not possible, you can also contact us on 717 118. I repeat, 717 118. This is a non-clinical helpline, so they won't respond to clinical questions, but will help to take details of those that might be requiring a vaccination. One of our team will arrange for your details to be taken to support decision making. While not permanent residents of the island, these people are often here supporting others in our community. And should they catch COVID, they will be just as vulnerable to those residents in the same priority groups. So it is something that needs careful consideration. The first port of call is for us to understand the numbers involved and what categories they fall. So please complete the form if this applies to you or a friend or a loved one. And I must mention, lastly from myself, we have had a self-isolation breach appear in court this very morning with a £10,000 fine handed down. So please, I repeat all of our previous messages around the importance of everyone following the self-isolation rules. Thank you. I'll hand back to Deputy Ferbrus.
Thank you, Paul. It's now the media's time to ask questions. Now, I'm going to start with an Alderney question, which I will read, and then I'll also attempt to answer, and then we'll come to the media based in Guernsey. The first Alderney question is, once we have cleared the existing case on Alderney, practically the only way the virus can get here is via the airport. The segregation of returning hospital patients has been through travellers from the UK and from the UK to isolate here has also been an issue. And I wonder if anything has been done to reinforce it in the airport. And the answer to that is we keep that under review. But there are very, very few journeys of any kind to Alderney currently. Those coming in, unless there's a special exemption, must all self-isolate for 14 days as a minimum. If the States of Alderney feel that there are other measures that could be or should be introduced, the CCA and the States of Guernsey will certainly seek to support them however they can. Local media, can I have a question, please? Can I have somebody put their hand up? Yes, Matthew, what was your question?
Matthew here from the Bailiwick Express. This is a question about vaccinations. We know CT Plus was told they couldn't take passengers to and from vaccinations. This has now been changed. What was the decision process here, and why weren't they allowed in the first instance?
Paul, are you able to deal with that?
I'm not sure to the background of that question, but obviously I think certain things have improved the situation. For example, the wearing of face covering will now be required on public transport.
Thank you. Can I have the next question, please? The next question, can I have a hand up so I can take the question? Thank you. Juliet.
Oh, I think there may be some problems. I think we've got a few hands up, possibly not appearing. But
OK, it doesn't matter. I've called you, so you can ask your question. Thank you.
Excellent. I know last week you gave us a bit of an update on where schools are and possibly how that might possibly reopen in phase 2. As I'm sure you can appreciate, we've obviously had a lot of questions in the media from concerned parents about trying to plan what to do next. I know it's obviously still very much under discussion, but are you looking to get, currently I believe students who are going into school are being tested weekly to make sure they're safe. I think it's around 300 pupils in school and they're being tested regularly. Are we looking to get to a stage where people are able to go back to school without being tested before we reopen the schools? Or are we gearing up to get to a stage where we're planning to open the schools and have all the pupils going back being weekly tested like the pupils currently? Just so people kind of understand what stage they're going to get kids back in school.
Yep. I'll come to Dr. Brink in a moment, but we've invited the President of Education, Sport and Social Culture to come to us tomorrow to join in the civil contingency meeting, and again probably the next meeting after that, because we want to be closely in contact with education as to how this will work, when it will work, and what the modus operandi will be. But Dr. Brink, we've heard what Juliet Puto has asked.
So thank you for that question. So the aim of the testing program at the moment is active case finding at the end of a outbreak that we've had. So we're going to do that with the key worker children and children identified as vulnerable and the teachers. We're going to continue with that. What we then
I think Dr. Frink's fresh. Yeah, there we are.
What we're going to do as we look onto stage 2, we're working with education to see whether there's a type of surveillance program we can put in, perhaps focusing just on the teachers. But this is really early days and it's part of the planning process. So the aim at the moment is continue with the weekly testing, look at what happens to COVID in the community, do a risk assessment on the basis of that, and then look at what mitigations we need to put behind phase 2, stage 2.
Thank you. Jim Delbridge, your question, please.
Thank you, panel. We've just had the first weekend where masks have been made mandatory. I was wondering if the panel would just like to comment how it went, please, and was there anybody fined? Any breaches? Thanks.
Well, I'll ask if he disagrees with me for Paul Whitfield to corroborate or otherwise. But my understanding is that no, it went very well indeed. There were no breaches. Nobody had a fine administered. People behaved as we would expect in Guernsey and elsewhere very responsibly. Ewan Duncan.
Hi, good afternoon. A question potentially for Paul Whitfield. We've heard that 25 police officers are isolating at the moment. Are you able to touch on the staffing concerns with the emergency services or civil servants at all?
Yeah, Paul?
Yeah, Ewan, I think it's been a problem for many large organisations that had to continue working, such as retail, law enforcement, generally across the civil service, supporting all the public health teams and everything else, and all the work that has to go into it. We had a difficult start, I would admit to that, where because of the large events we are now familiar with following the immediate lockdown, if you remember things like the dance festival events, etc. Like everybody else, we were hit with larger numbers of people that were associated with various events and contacts and meant that they had to self-isolate. I'm really pleased to say that actually the numbers are dropping, particularly across health, and we're getting and resuming normal staffing levels. But we have got, I would just add, we have got a substantial testing and surveillance regime in place for our essential services.
Thank you, Paul. Kate Prout from Channel.
Hi, panel. We've had an email from a viewer who says she's a mum and she's homeschooling. She understands that you can't give a date at the moment for schools and nurseries going back, but do you have an idea of definitely when they won't be? So say Easter time, will they definitely not be open by Easter?
That's a good way of putting the answer to the question. I'll ask Dr. Brink, but I think, as I say, we are in regular consultation with Deputy Dudley Owen. We will be seeking her counsel tomorrow and going forward. But I don't know, Dr. Brink, do you think you could add anything? It's very well plonked by Kate as to, well, you can't say this, but could you say that? What do you say?
I think as a mum myself, and although my children are now long thrown the nest, is that I can only imagine how difficult it must be, and I fully sympathise with that. I think what I would like to say is we're monitoring the situation on day by day, and we will give as much information as we can. What we don't want to do is set a date and then either overachieve and want to go before that or not hit that date. So we're trying to provide as much evidence, dare I say, to inform our decision making. So I'd ask her please to bear with us. We honestly will provide as much as we can, and she has my full sympathy.
Thank you. I'm going to ask another question on behalf of Alderney News, in fact. And the question is this: what is the trigger for the 14-day self-isolation requirement for travel from Guernsey to Alderney being lifted? And the answer to that is simple. The 14-day self-isolation requirement for Alderney was put forward by the States of Alderney. They wanted it as a protection for their island, and it was supported by the Civil Contingency Authority. So there isn't a fixed trigger for its removal. But the CCEA and the States of Alderney will continue to discuss it. And indeed, we'll probably discuss it again tomorrow. But I doubt that it's going to be lifted in the immediate future. But again, that's a matter that we'll be discussing with the States of Alderney representative tomorrow. Next question, Juliet Puto.
Yes, the panel very kindly gave us an update last week as well on quarantine hotels and how that was something under discussion, but obviously not looking to put in place right now. There was also a hint that they were looking at other alternative possible options. I was just hoping to try and find out what possible other options are possibly being considered.
Yeah, well, I mean, that would consider, for example, self-isolating the whole family if you're self-isolating one person. There also could be for further border restrictions, and there are other issues, but they are all under consideration and review. And we haven't forgotten about isolation hotels, but as I say, all matters are under review, and other ideas will come along as they materialise. So where am I now? Sorry, Paul, you wanted to elaborate?
Yeah, I just wanted to add that although we haven't got isolation hotels in place at this stage for compulsory travel, we have got a number of hotels and accommodation in Guernsey providing us with an excellent service of those that struggle to isolate in either the family setting for various reasons, or for some that are in multi-occupancy households who have had to move because of isolating requirements into these hotels that are providing this facility. And I have to say that these facilities have worked exceptionally hard with us to provide this service. So a thank goes out to them.
Ewan Duncan, your question, please.
Hi, a question for Dr. Brink, and it's to do with slide 7, which is on the slides that you displayed earlier about the asymptomatic and symptomatic. How surprised were you at the amount of asymptomatic cases, and is this consistent with data that we're seeing in other jurisdictions?
It's absolutely consistent with what I'd expect to see and relates to our strategy. So when we had the first cases, we were focusing on predominantly symptomatic people, phoning in JESIC, getting those people tested, getting them self-isolated and working outward from that. What we've now done, we always knew that around about 30% of cases are going to be asymptomatic. So what we're now doing is working out from those cases. And for example, one of the asymptomatics, the case that was shown as yesterday as an unknown community case, was got through our source tracing and is entirely asymptomatic. So it's exactly what I'd expect to see as you change from a reactive management of an acute outbreak into a proactive, trying to hunt down any residual cases to try and stop any flare-ups of the outbreak. So I think that's exactly what I'd expect to see.
Thank you very much. Jim Delbridge.
Yes, a question for Dr. Brink, please. Of those who've recovered from waves 1 and 2, how many are showing indications, or do we have any data on what's being termed long COVID, and how severe are the symptoms? Thank you.
So there are various entities with long COVID. There's the acute COVID, which can go up to 4 weeks, and then there's a sort of interim period between 4 and 12 weeks, and then there's what's called post-COVID syndrome, which is after 12 weeks. So this is something that our medical cell is actively looking at, and interestingly, the symptoms are completely variable. They can be transient, they can fluctuate, they can be persistent. The most common are fatigue and shortness of breath, but what our medical cell are doing is they're looking at how we can create a management package for people with possible long COVID. And it's something that Dr. Raby's been working on, and he's hoping to have more information by the end of this week, is that they're specifically considering it as a topic on Thursday this week.
Thank you. Matthew Leach.
A question for Mr. Whitfield. What further information can you provide about the COVID breach prosecuted this morning?
I can't give you any details at this stage, Matthews. I'm afraid it was sort of hot off the press this morning that I was made aware of it, and I thought it was worth putting into the briefing today to show that there is an absolute commitment where people make these breaches which create a risk to our community. They will be prosecuted.
Thank you. Before I come to Juliet with the next question, Juliet Puto, I'm just going to finish the third question we've had from Alderney. This is from Key FM, and it says that the question is this: given that it has been suggested that Alderney might move at a slightly different pace on lockdown, has the CCA considered allowing Alderney restaurants to resume takeaways or delivery where they can follow guidelines set last year? I think I've already covered that, but the formal answer to that question is the Civil Contingency Authority has discussed the timing of Alderney's move to stage 1. In fact, we'll discuss it further tomorrow. Alongside, obviously, as I've said and others have said, the discussion of when Guernsey moves to stage 1. And it may be, we've already seen it with Sark, that the three islands move at different speeds through the various stages. So, Juliet, your next question, please.
This is a question for Paul Whitfield. It's relating to the registration of non-normally resident islanders who are current people living in the island who might need to be vaccinated. I just want to check, will they need to have an NHS number to be vaccinated? Will they possibly be facing costs to have it done? Because obviously they aren't ordinarily resident here. What's the actual logistics going to be like?
Well, the idea is, first of all, is we want to capture everybody who's on the island who's not ordinarily resident, so we can understand the picture that we've got. We've already said we are providing and we will provide vaccinations for those cohorts. But firstly, obviously those that have an NHS number, we'll be asking for those sort of details so we can understand those that would normally receive vaccination within the UK through the NHS supplied line chain, which we are part of, and also those that are outside of that, so we can understand the true picture and how best to administrate that. And of course, the underlying aspect here is those people, for whatever reason, are in the island. Many are helping to support families. And actually, if they were to actually become symptomatic and had problems, they would actually be a risk themselves and also another impact to our health system. So it makes good purpose for us to actually look at this group of people.
Thank you. Ewan Duncan.
A question for Dr. Brink. I see it in the NHS and the UK are supplying free daily vitamin D supplements to those at high risk. Is it something that's being considered here in Guernsey, or is it something that, hopefully we live on an island with lots of sunshine, so it's not so much of a consideration?
So this is something, again, that has been specifically considered by the medical cell. I think I'd refer you back to the WHO guidelines, which would recommend vitamin D supplementation for everyone living in the Northern Hemisphere over the colder months. So I think that's entirely reasonable, and I would suggest people follow the WHO guidelines in relation to that.
Okay. Matthew Leach, your question.
I have a final question here. It's from the public. Understandably, fathers can't join mothers for antenatal appointments or scans at the moment, but we know a lot of parents would appreciate a recording of their scans instead of a printout. However, this isn't allowed either. Will any leniency be granted to allow recordings to be made of scans?
Can you help us with that, Dr. Brink, or is that a matter that we should go back to Dr. Raby on in due course?
I think I'd recommend we go back to Dr. Raby on that. There are good reasons, but I think he'd be able to discuss them in more detail than I would.
Yeah. What we'll do, though, Matthew, we'll ask Dr. Raby between now and the next broadcast. So one of us will be able to deal with that point next time. But thank you for raising it. Ewan, your question.
Oh, no, apologies. It's not taking down hands, sorry.
That's okay. I'll just make sure I didn't want to offend Juliet when she said I wasn't asking the questions quick enough before. So I don't see any other hands raised. So I think that is it for today. As I say, tomorrow is a very important day because the Civil Contingency Authority will be asked to and will make certain decisions. But sadly, I'd like to end this particular briefing with where I began. Our sympathies go out, all of us, I'm sure not just the people on the panel, but all of those listening, to the family of the poor gentleman that died yesterday. On that note, you'll hear from us again on Wednesday. Thank you very much.